Sports Headquarters.
Welcome back to Daybreak. Dr. Jag from Cancer Treatment Centers of America is a regular guest here on Daybreak, and this morning he's answering your questions.
We asked you to post your questions about cancer and different treatment options on our Facebook page, and now Dr. Jag's coming to answer them. I love this because our viewers have some really good questions. The first question asks, will my dad be able to survive prostate cancer without treatment?
Absolutely. And, prostate cancer is a very interesting animal in itself. You can have everything from very, very low-grade disease, which does absolutely nothing for a very long period of time, all the way to a disease that can change very quickly in a short period of time. So if you have an early-stage, early-grade prostate cancer, let's say it was treated and it was cured, and has nothing else going on, then absolutely you can watch over time and see what it does if the PSA starts to rise. And this is one of the things that we don't really understand in oncology. Why is it that some patients can live so long with such a disease with only the PSA going up?
And so the PSA will go up, but quality of life doesn't suffer, and
Right.
there's no other symptoms or problems associated with the cancer. And sometimes the treatments for prostate cancer really can negatively impact quality of life.
Especially when it's an early stage, early grade disease. Now, there's something you can do. Tomatoes contain a substance called lycopene, and that seems to be preventive in prostate cancer itself. So consider in consuming tomatoes as well. That might be something that might be helpful.
And let's move on to our next question. What are some warning signs for cancer? Are there any specific to certain cancers?
There are changes in your body which you need to be aware of, things such as unexplained weight loss, unexplained bleeding, unexplained discharges, and so forth. Changes in your body that is unexplained for any reason, such as bone pain, back pain, changes in your memory, changes in sexual function, and so forth. And the American Cancer Society has a small acronym for it called the word CAUTION, C-A-U-T-I-O-N. And that kind of describes all those things that you would normally see if you're dealing with cancer or trying to look for symptoms with that. And you can find that at acs.org.
C for change in bladder habits. A, a sore won't heal. U for unusual bleeding. T, thickening lump. I, indigestion or difficulty swallowing. O, obvious change in mole. N, nagging cough.
Absolutely.
So that's how that associates. Those are all things to watch for. Okay, the last question now. My mother died from breast cancer with no family history. My sister is considering getting a double mastectomy for prevention. What do you recommend?
Well, this is something that is in the media quite a bit. Christine Applegate was one of the most recognized people that had a double mastectomy, and she had a special situation. Her situation, she was a BRCA mutation present, so in her situation she was a high-risk candidate. Because your mother had breast cancer does not mean that you should have a double mastectomy as well, unless you know that your mother had a mutation in this tumor suppressor gene called BRCA. Then consideration and talking to your doctor about having a double mastectomy is something that should be done with the surgeon and so forth, because not everyone needs a double mastectomy at all.
If your mom has BRCA, then should you be tested for that?
Yes, you should be tested as well, because even if you do have a mutation, it doesn't always mean that you will develop cancer. It just means that you are much more predisposed to developing breast cancer and possibly ovarian cancer as well.
Right. Great answers to our viewers' questions. Thank you for coming in.
Thank you for the questions.
And Cancer Treatment Centers of America has a special offer for our Fox 23 viewers, a free subscription to the quarterly magazine Cancer Fighters Thrive. Just head over to fox23.com, click on the Fox box, and search Cancer Fighters Thrive to sign up.